So this video I want to demonstrate my best attempt at a workflow trying to document a thorough office visit for a relatively straightforward problem, generating an easy note and using no dictation. I'm mocking up a patient here who has arthritis of the hip and needs a hip replacement. So here we go. My first step when seeing a patient like this would be to review their x-rays before going into the room. So I would document at the same time by double-clicking on the x-ray which has been ordered. I would then click completed, and I'd go to my quick findings where I have templated out x-ray of the hip with severe osteoarthritis in the left and a normal right. And I'm going to save and close that, and save and close. So at this point, I'm ready to see the patient. I am in the orthopedic office visit screen, and I would then pick under specialty HPI the generic history and physical. I would enter the onset. Let's say this has been going on for 3 to 4 years. And that it is left hip and groin, and it is severe, and it's constant, it's aggravated by walking. Oh, I gotta do this. Then I'd come to the text box, go back to my phrases where I would find severe hip OA. I would click OK, and there's my text. And I'm not going to change that, although it could be modified, but I am going to take out my little finder marker here. Next step would be go to the exam. And this is a hip, so I'm going to open the hip template. And I'm going to find my default for a physical exam of the hip with severe osteoarthritis on the left and normal right. I'm going to accept the defaults, although they could be changed at this point. And I'm then going to go into my general exam and just document that his overall appearance is normal. I'm going to look at his skin, and I'm going to say it is normal in both the left and right lower extremities, and I'm going to make him oriented with appropriate mood and intact sensation, and vascular exam is already done in the hip template. At this point, I'm coming to the assessment. I am going to add osteoarthritis, and I will look through my most common diagnoses because I know it's going to be here, and indeed it's at the top. So there's the diagnosis code. And at this point, I'm going to open the assessment comments, and there's a couple of reasons. One is I think this puts the text in a place where it's easy to read, and the idea I have behind using this comment box is to write a note that gives me a succinct summary of everything I've done. So I'm going to just write that, and that'll make it easier to read your notes when you're looking for information. So exam and x-ray consistent with severe OA, plan total hip, failed conservative measures. Save and close. I'm then going to go to the plan and orders. I am going to open the lower extremity plan, And for meaningful use purposes, I am going to click Education. Hopefully we will have a less cumbersome solution to that at some point. And then I'm going to open Plan Details, where I'm really going to write what I want to say. I'm going to come down here under my phrases to my schedule total HIP summary. Again, I'm going to scratch out my header and save that, and I've done my office note. Now, as things currently stand, we need to generate our note here. I'm going to click the office visit summary to generate that. I'm going to go back to that same screen, and I'm going to generate my office note, or my full chart note. I'm going to go back to that screen one more time. I'm going to go to E&M coding. I'm going to consider this a high complexity visit since I scheduled and discussed surgery, calculate the code, and if I've done things, this will be a level 3 based on my physical exam, which it is. So I'm going to submit the code, and I am then done. What I would like to show you are two things. I can go here and I can look at the super bill I've created, and what you can see is I forgot to submit charges for the x-ray. At this point, that's not a big deal. I'm then going to go and show you how you're going to look at this and why I like the office visit summary. This is the office visit summary, and if you look under the assessment and plan, it's pretty easy to just see exactly what we did without trying to scroll through the entire office note, which goes on for some ways. So I hope that's helpful.